My name is Laurie Boston. I'm from California. I've been living in Switzerland now for almost 30 years. I'm a physical therapist, craniosacral therapist, and have my own private practice since about 10 years. In 2012, so about 7 years ago, I myself had a bicycle accident where I had a pelvic ring fracture, which had to be operated on. The pelvis had to be spread apart, realigned, and then with a plate and 4 screws to stabilize it again. So for the last 7 years, it's been a healing journey where I've had wonderful opportunities to be a client, to be a patient, and be able to see the world from my client's perspective. I think it has been a wonderful healing journey for myself, but also a very important step in my life to understand what it means to be the one laying on the treatment table. So with the question is how did I come into the matrix therapy? This type of problem that I had, there's always little traces of imbalances that I still have to attend to. And I was developing some problems still with the pelvic area, but now a new problem arise from the knee. So I was having some tensor fascia lata problem and lateral knee pain. And I realized that a very close friend of mine that I have known since I was in Switzerland, she was moved back into the area and she is doing myofascial work. So I actually went to her for myofascial work. She worked on me after doing her assessment. She worked about 30 minutes in the way and she says, well, I'm going to try matrix therapy. Do you mind? I said, well, I don't know what it is. So she brought this machine over, which looked to me like an ultrasound machine with a vibrating head, and went to the knee and worked on the tightness around the knee, and then she was working up into the hips, and then I hadn't really told her about the problem that I had in the pelvis, but she had noticed that already, and then so I told her the story, and she looked at the pubic area and the scar, which I had thought that over the years, with all my different type of treatments, I thought it was pretty good. I mean, I still had some discomfort, but I thought, well, you know, I'm going to have this discomfort. I mean, that's part of life. You know, it's not excruciating anymore. It's just pressure there. And so after that hour, during that time with the matrix, I was just totally surprised and really astounded that when you work with the matrix on the lower belly, that I felt this swing throughout my body up into my eyes. I mean, it was just an amazing treatment to feel, because she was working on what I thought a local area, but I felt it really far away from where the treatment was being done. And so I really thought, I don't know what this is, but I gotta get one of those machines. Well, it's not very easy. You just can't go out and buy the machine. You have to first take a course, just a day. I bought the machine, and I went to the course, bought the machine, and then I started working with it. But I wasn't getting the results. And now, a year later, now that I'm here with this the seminar, I really realized that it's not only the machine, it's the pilot that's directing the machine. So in the year that I was kind of using it a little bit, I really wasn't using it at its optimal level. So I used it maybe a couple minutes here, a couple minutes there, but I didn't have the handling and really the deep understanding of what the machine is. So in these few days that I've been here, it's been a really eye-opener of what it really means. And so I'm really looking forward on Saturday when I go home, and Monday when my first client comes in. I'm really looking forward to all the wonderful things that I can now try now that I have a better idea of what the handling is, and not just turn on the machine and do something. So I'm hoping that with the practice of these days when I get home, I can also give to my clients what I've gotten from a professional using the matrix machine. So I want to thank everybody who has provided this information for me.